To learn more, we're joined by concierge physician Dr. Abe Malkin. Thanks for joining us, doctor.
My pleasure.
So is it the measles something that should just be concerning for parents of young children, or can the measles also affect adults as well?
The measles is particularly dangerous for young children, but it can affect people of all ages. You know, measles is highly contagious, as you mentioned in your intro. It can be spread through air droplets, through coughing and sneezing, through physical transmission. So it's very infectious and difficult to control. You know, roughly 2 out of every 1,000 people who will contact someone with measles will get the virus and develop complications from it, which is especially worrisome for the younger population, although it can affect patients of any age.
Well, obviously, a lot of people are saying this is because of the lack of vaccinations is the reason why we're seeing this reemergence of measles in America today. Is that probably the only reason, or is there any other reasons why you think why we're seeing this disease and possibly others that are starting to come back in, like polio? We're starting to hear cases of that start to happen again.
Sure. Measles and polio are two viruses that we typically vaccinate young children for in their first year or two of life. So certainly unvaccination is a big contributing factor here. That being said, other factors such as ease of travel are another factor. People in the United States often travel to other countries where there's not readily available vaccines and then come back to the U.S. where they can easily spread the virus through contamination. So I would say that unvaccination and ease of travel are two main contributing factors.
Well, doctor, I know this concern regarding vaccines has been happening for at least 12, possibly even 15 years, even 20 years, I would say, is when it first started. Is there an age where if a parent decides, you know what, I do want to vaccinate my child, that they're too old to be able to get this vaccination?
Yeah, usually children get it within their first year of life and then get a revaccination around the age of 5. You know, once they get beyond that into the teenage years, it's a little bit too late. So it's really important that parents, get it done again in their first year of life and then at their age of around 5.
Okay, well, that's the thing I've talked about. Vaccines have become a very controversial issue that is happening. And no parent wants to inject their child, especially with the live virus that some of these vaccines are. What do you tell parents that come in with you and say, you know what, I'm very weary because of stories they've heard, whether true or not in the past, of reactions to it. What do you tell parents to ease their fears when it comes to vaccinating their children?
Sure. It's an understandable concern for parents, but the overwhelming majority of healthcare professionals support vaccinations, and we've been able to eradicate multiple very serious diseases such as polio because of vaccinations. So I would tell people, get the vaccine, prevent your child from getting measles, and also help prevent other children from getting measles. And if you do have further questions, please talk to your doctor about the risks and benefits and have an open conversation, an open mind about it.
Well, a lot of people want to also talk about these are coming in not only just because of the vaccines, but because we're seeing more international travel happening today. And we're also seeing, obviously, with some of the migrant caravans or other issues. Is that something that we should be really paying attention to? Or is that a fear factor in talking about some of the diseases that might be coming in and out of our country?
I mean, certainly we have to be aware that people in other countries who don't have access to the same health care that we have in America may be more susceptible to these viruses than we are in the United States. So therefore, people who aren't as concerned with vaccinating here have to take that into account when they think about the risks and benefits of the vaccine. Certainly, traveling outside the U.S. puts yourself at a bigger risk, and then coming back home to the U.S. where you could potentially infect other people is definitely a risk factor that we need to consider.
Well, one of those issues that we heard was that when vaccines, like the measles, as well as other issues that have come up, when the first batch came out, that obviously there were some issues that came into it. Is there a difference now, especially with the polio vaccine as well as the measles vaccine, from that first year, 2 years, where they saw a lot of issues that happened with those first batch compared to today? Is it a lot safer today than the vaccines than they were when they first were introduced?
Sure. Medicine is always progressing. So the vaccines are always being made safer and safer every year by the drug companies to help prevent any potential complications. So the vaccine that you may have seen a couple years ago that had potential side effects has been mitigated now in the new strains of the vaccine, which really are extremely safe and have only had a very small number of complications.
Okay, last question I have to ask you. A lot of parents point to the idea, the fear is that this is one of those that vaccines help cause autism. Are you one of those people that can see any scientific research that backs that up as to why parents don't get their kids vaccinated as babies because they fear of autism down the road?
Yeah, I've heard that a number of times from concerned parents, and obviously parents want to do what's best for their children. But to this date, there is no large-scale studies that have proven the link between vaccines and autism, and maybe there may be anecdotal stories of that which concern parents, and that's understandable, but there has been no large-scale studies supporting that.
Well, thank you so much, Dr. Malkin, for joining us. No parent ever wants to see their child in pain, and hopefully a little bit of prevention can cause longer trouble from happening. Thank you.
You're welcome.
Hey YouTube, thanks for checking out our channel. We hope you enjoyed the video. We have tons of content for you just like this. For more of RT America's one-of-a-kind news and analysis, be sure to subscribe and never stop questioning more.